We have a good one today. Ladies and gentlemen, we have Dr.Cat Powell with us here today, and we're going to talk about so much, but we're going to touch on everything that's important for you guys to know so that you can have a better life and feel better in your life and have the people around you feel better. And we're going to talk about all these things and more. But first, Dr. Cat, how are you doing today?
I'm doing well. I got outside on this lovely day for a nice walk earlier, and now I get to enjoy this time with you.
Yeah, you know what's wild, Dr. Cat? I'm starting to see people wear like hoodies and sweaters and stuff, and honestly, it's making me a little depressed.
Yeah, I prefer the warm weather too. And I am somebody that certain mornings I might have turned on the heat in my car, being a little bit of a cold diversion.
Oh yeah.
So,
Yeah, once the winter comes along, I'm the type of person that goes into the car and just starts screaming because I'm freezing my head off.
yeah,
Like it's intense. It's intense. So I get it.
it is.
Um, but you told us a little bit about yourself and your cold aversion. I want to hear more about you though. Tell us about your story.
All right. Well, I grew up here on Long Island in Valley Stream, and I played soccer, basketball, and lacrosse. So I was always competing in sports, always the kid that wanted to move. Had a lot of injuries, which is what ultimately led me to physical therapy. And I went to Marymount University in Arlington, Virginia, where I got my bachelor's in health science and got to run the monuments for my college teams, timed runs, and which you get sick of the Washington Monument and the Lincoln when you're going for time, but it was beautiful the first couple of times.
Hmm.
Um, and so had fun down there before coming back up here to go to Stony Brook for PT school. Um, I did the 7 years straight, and through that, still trying to maintain some activity. PT school made that a lot harder, where walking and yoga were some of the main focuses to squeeze in during the day versus coming from college athletics where you're working out 6-7 days a week. Um, but it was nice then getting into things like CrossFit and hot yoga, especially after I graduated, and exploring different trails with friends and just trying to be outside. So that's kind of where I'm at now. And it's been fun just, continuing to move, continuing to find activities. It's always fun with a team, and having people motivate you. So that I tend to like group classes more.
Yeah, yeah. And so you touched on your activity level. You've done a lot. I mean, you mentioned soccer and lacrosse and CrossFit and all this good stuff here. How has that impacted the work that you do with people?
If anything, I can definitely relate to them more because, especially, ankle sprains, knee injuries, groin strains, shoulder fractures. I've had concussions. I can empathize on a level of I've been there too. I've been the patient, or I've been somebody that's had to modify their daily activities because you can't, your arm's in a cast. You can't brush your teeth with the same hand. You have to change it to your other side if it's your not, if it's your dominant hand. Um, and then the biggest injury I had was in high school in ninth grade, and I tore the ligaments in my ankle coming down from a rebound. And it was the third bad sprain within a year and a half, and I needed surgery.
Uh-oh.
And that same day, the orthopedic told me I needed surgery. My grandma passed away. And so that was a double whammy of I couldn't grieve how I typically would, which would be through exercise or, running or kicking a ball. And I had to drop out of all the teams in the upcoming seasons. And
Uh,
it was the first injury that I realized how much emotional it was as it was physical. And so I understand when people are frustrated and that, they're like, this is so, they think it's stupid that they feel so down because they can't do something normally, but it's really common and normal. And it's an emotional roller coaster trying to do something when you're in this cycle right now that pain might be preventing you. But it is possible to break that cycle, and that's where the body's resilient. And sometimes you just need the right people or the right tools to help get you there, and work it
yeah.
out.
Yeah, and I think it's really cool how you connected the idea of emotions related to the physical, right? And you also brought up this idea of empathy. And this is something that I see in you. I mean, from the moment that I met you, I knew that you were an empathetic person. Like you're clearly a person that cares about other people,
Mm-hmm.
right? And so even you talking about your grandma and the fact that you weren't able to grieve the way that you did, I saw your emotion flow there, and I think that it's today we're here to talk a little bit more about caretaking and everything surrounding that, right? And there are moments in my own life where I've seen caretaking and how difficult it could be emotionally, right? And how
Mm-hmm.
much empathy is required when you go through the caretaking process. So if it's okay with you, I'm just sort of curious here because we're going to talk about your lessons learned about caretaking, and that's what we have in the title. But before we even delve down that path, do you mind talking to me about what are some signs that people are going to need caretaking, or what are the problems that lead people to needing to be taken care of?
So it could be a bunch of different things. It could be a cognitive decline, like Alzheimer's or dementia. And people start forgetting to pay bills. They start forgetting to eat or how to eat. Might not be able to care for themselves. And that was actually something we had to um, deal with my granny who declined of Alzheimer's. And I give my parents a lot of credits too because when their parents were aging, they also were taking care of them as long with my sister and I, who were in elementary school, high school, and then even in college, but our final grandparents passed, but they those little things of when they could no longer be independent anymore. Managing, their finances responsibly, not picking up the phone. One of my grandpas, his was more of a physical decline, where he couldn't do the stairs anymore. And that was very difficult getting him in and out of the house. There could be, you know, also mental health issues that then can manifest into physical issues as well, of like poor hygiene, diabetes, and not doing proper foot, and skin checks, and having these ulcers become infected or very problematic for people, whether on their heel or their bottom, if they can't get up and move a lot. If they're not able to take their medications the right time of day, the right dose, or maybe they forget, or maybe physically it's hard to just open the pill bottle. Um, and sorting pills is a very time consuming job, especially for people who are on a lot of medications and they have to take them with food, without food, morning,
Mm,
middle of the day, nighttime.
mm,
And just to organize the pills for the week, to have the cognitive and physical ability takes a lot. And so that's somewhere where, as a caregiver, would be good to come in before, if you're not taking your blood pressure meds and the person has a stroke because of it, because their blood pressure was creeping up from not adhering to it, then that those are some certain signs to look for. The And say again, if, like, are they reaching out to people or are they isolating themselves? Are they able to stand and cook a meal, or are they not? Or are they getting takeout, or leading to other things? So those would be, um, can they drive? Are they safe to drive? Can they get
got it.
in and out of a building safely, or do they need assistance? Do they need a device? So those would be all things as people age, or as people become disabled or have a various disease or disorder that creates these problems sooner in life. Those would be different things to look for, and make sure that you guys can find somebody to either help them, or you help them, or make the environment safer for them.
Mm, mm. Yeah, so physical decline, cognitive decline, and mental health issues can all lead towards the path of needing to be taken care of because that's when you'll lose your independence.
Hmm.
Okay. And this loss of independence, do you generally find that it's something that happens in a short time period, or is it a longer time period? How do you think about that?
I would say the majority of people, it tends to be gradual. It tends to happen little by little. We think of Alzheimer's of, oh, I'm just, getting confused, or I'm getting, senile jokingly, or it's like I forgot where my keys are again. Whereas somebody who has a spinal cord injury from, diving in and hitting a sandbank, that's obviously then becomes an instant disability, requiring more immediate care. But if we're talking about the general aging population, if we take out acute trauma, that it's little by little, people tend to lose function. And again, aging is normal. It's
Sure.
a process. We're not the same today as we will be tomorrow, and as the lifespan continues to increase, different health and musculoskeletal. I don't want to say issues, because they're not always issues. It's just a part of aging that happens. And you can still be very independent. And that's where, you and I, we help people move to maintain that and maintain their strength as best they can. And so there's definitely ways you can help slow certain progressions of negative aging so that you can age more positively. But there are also instances that we can't control, if somebody gets cancer or not. We can't control, certain things just happen.
Sure. No, and in my experience, I speak to people and they share with me that they're really concerned about this idea that they're not going to be independent in their 70s, 80s, even 90s, right? And that's part of the reason why some of these people come to me and they want to start moving better, and they see how it's going to influence their lives in the long run. Now, in terms of your own experiences, you mentioned your grandfather, for example, being unable to go upstairs, and you mentioned some things in relation to your grandparents there. What are some emotions that you saw them go through as they were starting to lose their independence?
Well, my grandpa, he actually lived to 104. This grandpa broke his hip at 100, had a hip replacement, was that patient getting in trouble for doing too much. He was a very motivated guy, and had
so
a
that's where
heart
you get it from.
Yes, yeah. That's on the Polish side. So all of his siblings, he was one of 6, they all lived into their 90s. So I'm hoping I take after them. And so with him, it was tougher for him because he was cognitively intact to watch himself decline. That was if anything, for him, because as much as he still tried to do as much as he can, he eventually had to accept the fact that somebody needed to help put socks and shoes on him, or that he needed to go from a cane to a walker. And that was more so after he broke his hip. He was using a cane up until 100, so he was doing pretty good. And so it was these little daily things, but he always continued to have a positive outlook, where he would say, I pray every day. I'm waking up in the morning. I'm here. I enjoy it. I enjoy my family, my friends, having a community to talk to, and, enjoy a good meal. And he would just do his exercises, arm and legs up and down like that, in bed or the chair, wherever he could. And that's what kept him going. So I think, again, he had a very positive outlook, but I'm sure there was still frustration going from a very independent, strong person. And he cared for my grandmother, his wife, who passed away when she was in her 70s. And they were 14 years apart. So figure he's in his 80s at that point. He was still strong enough to help his wife. And for a lot of people or couples that age together, that can also be a scary feat if they can't take care of their loved one because they can't physically handle that work. And my grandpa was fortunate he could, but that's not always the case, and that adds more stress to families and the different dynamic and relationships that then have to develop, or the different roles that people have to step into.
Yeah. So it sounds like for your grandpa, he basically ended up going from somebody who felt really strong, really independent, to being relegated to a position where he was frustrated at the idea that somebody had to help him with socks and shoes and everything like that. With Now, in terms of, we're talking here a little bit about people who are getting taken care of and what they're going through. I'd love to hear more about what caretakers themselves go through. Describe some problems caretakers go through.
Absolutely. And for anyone who's tuning in, Ahmed knows this about me, but my father passed away from cancer earlier this year. And so I'm also speaking on a firsthand basis of, just the hard that my family and I had to go through. And so personally, caregivers, it just becomes your focus is on your loved one that's in need. And their appointments, their medications, their food, their meals, if they have the ability to bathe themselves or not, or toilet themselves or not, if they're getting sick, like vomiting, which a lot of people with cancer do, and having to, you barely sit down and then something happens or they get sick, or you need to do laundry and, tend to whatever else in your own life. And so it was just it was such a long game. It was more of a marathon of a period at times that my dad would get stronger. And then I would, we could all kind of breathe a little bit and take a rest for ourselves. And then as he needed more and more help and the daily demand and helping him grew, it just was very exhausting. And at times emotionally draining, but you do it out of love. You're just in survival mode. And that's the hard part when you're just trying to survive. You're trying to help your family member as best you can. And then you're still managing every other aspect or relationship in your life at the same time. So that it's just a very hard place to be in, but you do it because you care about them. And, in my family, I feel like my parents demonstrated that by helping their parents. And so it was without question that my sister or I would help them too. And if we have kids one day, we would hope that would be the same too, having somebody to look out for you.
Yeah. And I mean, your story with this, I have a lot of respect for people that are able to go through that, because like you mentioned, right, you end up being in this survival mode. And I've seen this with my mom. My mom has been taking care of her brother for almost a year now. And just seeing everything that she's going through and how, when his situation changes, how it affects her and everything, her whole life is basically around him, right? And so it's difficult. I mean, she doesn't work, but she basically has a job that's 24/7.
And
right?
that's
and so
it. Yeah.
and so exactly, right. So tell me more about survival mode. What's that like?
It's you're just running on fumes, and you don't even know how you do it. When, like, looking back, I don't know how my family and I did it. Which I'm sure your mom in time would also look back, because it's endless appointments. It's making new appointments. It's dealing with insurance companies. And I would say my mom did the most of that, because they're married. So she had, the bills to still pay for them. She still had to take care of the house too. Where I don't live with them, so that I was traveling to and from to help them out. But survival mode, it's like you just you don't even remember like what you did 2 hours ago. You're just like going, or it's just, we don't even remember what we did for Christmas, or what we ate rather. Like, we were in Memorial Sloan Kettering, and my mom and I were both like thinking about this the other day, and she's like, what did we eat on Christmas? And I was like, I have no idea. Like, I know we were in Sloan, we were visiting my dad, but there's certain like gaps in your memory that then just happen because it's just the overwhelm. It's the looking out for them. And it creates a very heightened state of stress. And then, like, you and I, obviously, we work on trying to downregulate people and trying to decrease stress and mitigate it to help you optimize your workout, your sleep, your nutrition, all these other factors. And it's hard to fully say that when you are in survival mode and when you don't really have a choice, you know, or it's very hard to find resources that can help you immediately, because not everybody has friends, family, aides, or facilities that their parents or their family members in that can help with the other 23 hours of the day, um, and
Yeah.
sometimes that's like your mom, or it's just that is her job. And she's fortunate she's in a position that she doesn't have a full-time job on top of that, because that would make it that much harder. And even as the person who's sick themselves, or having trouble being independent. I mean, my dad, he had to go on disability. He couldn't work, and he would be sitting, in waiting rooms for 2 to 4 hours, not knowing when he was going to get called in, or having a sudden change of his function, and his blood pressure would drop, his heart rate would drop, he would pass out, he would spike a fever, whatever it was, that he had to go then to the emergency room. So that also changes, that's the day-to-day roller coaster.
Yeah, it's but it doesn't sound like it's a fun roller coaster.
No, it's not.
It's I think when I hear about you talking about this, it feels like it's an all-consuming type thing.
Yes.
It feels like every day is based on how can I just make it to the next day, and how can I make sure that this person is just okay.
Yes. Yeah. And it gets hard when also then trying not to blame yourself or think, did I do enough? Did I fully, help them? And because that's where you're doing the best you can in that moment. You're trying to get through, you're trying to get the minimum needs met. And then, you're cleaning up stuff, you're organizing so many other things, and it can just become very overwhelming. And even more so if you don't fully understand about the diagnosis or the needs at play. If you're not in healthcare, and even though I am, and I was still overwhelmed by a lot of the information that, the oncologists would throw at us, all the side effects to watch for, all the usual ones, the not usual ones, the different types of treatments, the different risk associated with that. I have obviously a basic understanding, but it was still so much, and it's different when it's your loved one, when they're in that chair versus a patient.
Yeah. It's an incredible challenge. I mean, you talk about needs here, right? And when the people that are being taken care of, do you find that they are able to vocalize their needs, or how do you think about that?
Some people are, some people aren't. Both from a cognitive and or physical function. I can see it for people with Broca's aphasia, which is a part of the brain when people have a stroke that gets impacted, where you understand everything, but you can't, the motor pathways to speaking are disrupted. So you can't choose the appropriate word. So they'll say, ball, toy, now. And it's like, what do you, ball, toy, now? And then they know what they want to say, but it's coming out wrong. So then it adds to frustration of not being able to fully state their needs, even though they can understand you clearly, of that's easier for the yes, no. Are you hungry? Yes. Are you tired? No. Are you in pain? And going that route. Others who are able to vocalize their needs sometimes feel like a burden to their loved ones too. My dad had always been a very independent man, and he felt bad that he was putting this strain on us. And he would try to do as much as he could, but then it was getting to a point he just couldn't. And he didn't. So if anything, sometimes he would just lay there, not want to ask us, even though we didn't mind, because he felt insecure, or not, I don't know if insecure is the right word, or just upset that he couldn't do it himself, and he was then getting frustrated. And then you have some people that can't communicate their needs, and might not fully understand. Let's say that's somebody like with Alzheimer's or dementia, and um, you know, they also like lose the ability or don't know how to use a fork. So you might just need to recognize that you have to start spoon feeding them now, you know, or when they start to become agitated, maybe they have a UTI, which adds to confusion. Maybe if they, you know, subtle signs and symptoms, knowing your loved one from observing them and their patterns and what their normal is, you know, just like every parent knows their child best, it's the same thing with your loved one. You know them best, and advocate for that to the healthcare providers too if you see that something's off.
Yeah, it's you know, I think about there being a when people are going through this process, and you have the person who's taking care of the person who is having difficulty being independent, and then you have healthcare, right? And you have maybe all these different doctors. It's not just one doctor that's taking care of this person, but it's all these different doctors. What do you think is the biggest problem in that triangle of care, so to speak?
It can be so specialized where you're getting so much information from everyone, but then there's nobody in the middle to help consolidate that information, remind you of the points. And that's my mom and I, especially early on when my dad was first diagnosed. She and I were both writing down every word from every provider that came in the room. And that was something else we looked back on and we were like, we didn't even remember they said this. Oh, shoot, you weren't supposed to eat that. That's not part of the antimicrobial diet. Like, you know, these things. And that's actually where health coaches are becoming more and more that middle person to help take from all these different outlets and be advocates for people to understand, you know, all the different providers, what they're saying. And in best case scenario, having multiple providers, if they're on the same team or like they're collaborating with one another, it makes it smoother. But in many cases, it's like, oh, well, did my notes get sent over from my nephrologist to my cardiologist? No. Or did they even talk? Probably not. You know, especially if it's a big and busy, you know, place. Did you even get more than 5 minutes with people? Or did they just prescribe a medication and go? And that's the harder part, you know, of trying to hope that the provider has your best interests or try to trust their medical experience, but yet the system doesn't always allow the time or the proper care for people, which can then add just more layers of frustration to your journey, you know, or the person who's sick or in need of the services, and it makes it just more complicated, and overwhelming.
Yeah, because you're getting all this information thrown at you, and you're not sure exactly how to collate all of it and make it actionable.
Mm-hmm. Yeah.
Got it. Okay. Well, let's talk about the caretakers themselves, because it sounds like, you know, you've been through a lot. I know my mom has, and all of these people, they're doing so much for other people, and it's really hard to meet their own needs. So how can caretakers manage to take care of themselves through this process?
Absolutely. And I feel like it's, you know, the saying, you can't pour from an empty cup, and to keep telling yourself that. And that was something, you know, I tried to keep reminding myself, because I'm a caregiver at work when I'm working with my patients. And then I didn't have any more rest as he declined, and I had to go home more to bring him to appointments. And that was getting challenging to, again, you're in survival mode, you're in an overwhelmed state, you're stressed out, you know, it's a sad situation in cancer. At least I can relate to that, of watching your loved one decline and watching them in pain and watching them suffer. And that it's so multifactorial. So but that's where it's like I knew I was running on fumes. And so the little things that I would try to do each day, even if it was 5 minutes of just standing, doing a few stretches, or standing up as we were in the waiting room or in the, the doctor's office waiting for them to come in, I would just do different stretches, do calf raises, going for a walk to just get myself outside, give myself 10 minutes, to walk around the block. So it wasn't a lot. But I've tried to find 5 to 10 minutes a day or multiple times a day if it was a lighter day to just get that movement in. The other thing was, it's hard eating on the road a lot, or as much as my guilty pleasure is a dirty water dog in the city. I love hot dogs. But as much as that was the cart that was outside of Sloan Kettering, well, every so often, okay, that does the job. I was feeling too grimy, and I was like, I knew I needed something nutritious in me. So I found like a fruit smoothie and juice bar that was a few blocks over that I would walk to while visiting my dad. I'd go in for a couple hours, say I'll run out for lunch, go grab the juice, or something healthier, or trying to fuel myself or try to prepare knowing I'm going to be on the road. Can I choose a slightly healthier option, even if it's takeout, so that I'm not feeling as grimy or low, and then other days, we went to Burger King. When we got home, it was 9:00 at night from Sloan. We weren't cooking, and so that was, we did it, and it was just like, we all felt our stomachs turn after that. But we knew we needed to eat, because it can also be very hard for people to get meals in as a caretaker. You might make the meal for the person you're providing for, but then not eat yourself. Or just have a bag of chips or something that's not nutritious. And then that lowers your fuel tank reserve as well, of not feeling as optimal. So again, it's like short walks, as healthy of food as you can, or having snacks to give you energy during the day, because they're going to be long days. The other thing was allowing myself to sleep when I could, or to find rest when I could, because that can be it's just like you sleep with one eye open, especially if you're waiting to hear, or in case they get up in the middle of the night, you're afraid they're going to fall, or maybe if they need something, but trying to find sleep when you can. And the biggest thing is, if you can find friends, family, or a community that could be there in the event you can't be home, or you can't take them to an appointment. Like our neighbors took him to some appointments when we all had to work and we just couldn't take off the whole day. My mom, sister, or I. My uncles flew up and stayed with us for a couple months so my mom could go to work, because she didn't have, the full-time family leave available. The other big thing that was so helpful, and for anybody who might know somebody who's caring for a loved one, even if you're not a caregiver right now, when my father passed, a lot of people brought meals over in those following weeks, which we greatly appreciated. But the ones that we've really appreciated was in his decline, in his last couple months, when we were going back and forth to Sloan and then back and forth to hospice every single day. When we had home cooked meals, or just or takeout, from some better restaurant that's not, again, like a fast
Burger
food.
King.
Yeah, not Burger King. That meant so much to us. And it was just like we could take a breath knowing that we had food to come home to, that we didn't have to make, and that we could just heat up. And that was the most generous things that people did. And my family and I really appreciated that. So if you know of somebody in a tough situation, it's you don't need to wait for that person to pass away, to whoever they're caring for. Just by doing a little something now really helps caregivers who are in survival mode. And it's especially hard for the people who are doing this and their loved one is stable, so to speak. So they're not anywhere critical that they're going to pass anytime soon. It's just their new way of living. And they just are very dependent. And, you're there. So that could be, years that people are caring for somebody. And that those are like the unsung heroes who are doing it day in and day out. And so, don't forget about those people if you guys have anyone in your life that's caregiving every single day.
Yeah. It takes a village, right?
Mm-hmm.
And here sometimes the similarities that people like to draw, I found, is that people like to draw similarities between taking care of a like a toddler or baby and taking care of somebody who you're caregiving for, right? But I think there are a lot of differences. One, first of all, the relationship that you've developed with this person, right? You have years of relationships with this person, so your emotional investment in them is so high. At the same time, it's tough when you're in the scenario where people aren't necessarily declining, but just have a new way of living. And so there's almost no specific time span that you can look forward to where you can think, okay, maybe one day I'm not going to be so stressed out anymore. It's this continuous cloud over yourself, right? As you try to make stuff work for yourself, because basically what I'm hearing is that it's almost impossible to take care of your own needs as you go through this, and you will need the help of other people. I mean, you mentioned your uncle, your neighbors, and people helped out. I think there are a lot of people that aren't that lucky.
I agree. And there's not everyone who has somebody at bedside or with them for appointments or in the hospital to be there and advocate. And that was when my dad first declined and became diagnosed. He was so mentally out of it. He has no recollection of like those first 4 months. They kept giving him the wrong medication that he was allergic to. He was in no physical state to make those decisions, really, and have somebody. And we were fortunate that we were there and keeping track with our notes, whereas a lot of people don't always have that support system, and so that makes it even tougher. And where, though, if you're involved in a church or some other community, to help, reach out to them. There's also, obviously aides, to find a good aide. If, just to give yourself a few hours a day, at least, that you could run errands or do whatever you can. A lot of towns do have elder support groups. Like if you were to call the town of Hempstead or Brookhaven or Riverhead, typically they have resources for people aging, to whether it's ramps, whether it's shower, bars, or sometimes they have other tools and resources that they can provide locally. So definitely, everyone can Google nowadays. And even though I will say, when you don't have a break, it can be really hard and overwhelming. And my family and I, we were guilty for not always looking into necessarily the best thing, or if we could get by with what we were doing, but we were just also so exhausted. But when you kind of have no choice, but if you can find something that can give you a little bit of breathing room or make your life just that much easier, caring for your loved one, and easier for them too, whether that's a ramp or something. And, there are a lot of different resources for caregivers and support lines. And even if it's going to therapy or talk therapy or doing it virtually now or on the phone, just having an hour to vent and give yourself that space, working with a social worker or somebody would be also beneficial, to give yourself that hour of time.
So finding community resources, allowing yourself to have a break, and talking to people that you think can help you with your own mental health can be really beneficial. Now, Based on your experiences with your father, and once again, I'm so sorry that you had to go through all that. I couldn't even imagine. What are some things that you learned from that experience? If you could basically do it over again, tell me about a few things that you would do differently that you think would have made the experience better for everyone involved.
It's hard to answer that with the caveat of saying, or like with my own support systems and groups and mental health providers that I've worked with, of allowing yourself grace during that time. Because we can always look back and like, oh, we should have done this or we should have done that better. But as they all pointed out, like, you were doing the best you could in that moment, or for those months, like you were there as best as you could be. Because there would be, I could find a lot of little things that when my dad couldn't really keep food down, or was having a hard time chewing, taking more initiative to make him a smoothie or bring him applesauce or something to see if he'd tolerate it. Then again, he was also stubborn and like, I'm fine, I just won't eat. Like, so he also pushed back a little bit. It's not like he was just waiting for us to, do. He sometimes got a little bit frustrated again and was just like, I just don't want anything. I don't feel like throwing it again. Even if we would say you need nutrition in you or you need something. So like that would be something though of just providing him more of the options, but it also got compounded and tougher when it's like he's declining food. And then when you're just so tired and you're like, I don't feel like, I still have to work, or I still have to go do laundry, or I still have to, do the rest of the dishes or something, like other things, when you're just like, do I
You just want to be done.
Yeah. And so it's, again, that there's many things looking back that maybe would have helped him and us a bit more. But as all like the mental health providers that I've spoken to have said, it's just like, give yourself grace in those moments. Because again, you're in survival mode. You're doing the best you can with what you know at that time. And we can all play the Monday night, quarterback, and we have, oh, we should have done this, or they should have played here, and just going back and analyzing the game. It's different with
Easier
life.
said than done, right?
Yeah. Mm-hmm.
Yeah. So basically the main takeaway there for you was to allow yourself to be gentle with the decisions that you made at the time, or with the way that you were living your life at the time.
Yes.
Okay, I get that. And then on a more tactical level, I mean, you mentioned some resources. Tell me more about those resources.
Yeah. So depending on your loved one's diagnosis, if we're talking more about chronic disease or disability, so like the American Cancer Society, on their website, they have a 24-hour hotline that anyone can call, whether you're the patient or you're the caregiver. It's again, American Cancer Society. They come up on your first Google search. And there's also caregiver support resources with a lot of PDFs and documents. And that's something, though, again, when you're in the thick of it, or especially when it's critical, you're probably not going to look that up because you're just trying to survive. In the slightly calmer periods of the storm, like when your loved one might be more stable or slowly progressing, that would be the time to try, okay, let me see if I can find anything here. But in regards to like a hotline, that you can call at any point, that you can call while you're in the car and just to speak to somebody. So it's a free resource. So it's like, if you don't have a therapist, or if you don't have time to meet with somebody, or somebody can't talk, or you have a question about, cancer aspects or housing or lodging or, transportation or feeding tubes or whatever it may be, people can at least direct you when you call that number. Another one is the American Heart Association. They also have a ton of resources of different ways to help, improve your lifestyle choices, how to manage diabetes, if you've had a stroke, if you've had a heart attack. It from their site, initially it's like speaking to the patient, but if you're a caregiver, following, walking daily, eating more fruits and veggies, trying these other things will be beneficial for you as well. Or they also discuss common procedures. So like, what happens when you get a pacemaker? Can I shower? Or when can I shower? What movements might I not be allowed? And they have different resources to help educate you there. And then there's the crisis center hotline. They've now they normally had, that's from anyone who's in a mental health crisis. Again, it could be your loved one or it could be you. If someone is having suicidal thoughts or ideations, or having a panic attack, or whatever it may be, or again, it's just extremely stressful, or you're feeling very anxious or depressed, the crisis center, you can either call them, or now you can do the crisistextline.org, and now you can text the provider or right away. So if you're struggling, you'll be able to get hooked up with a mental health practitioner who can text with you and try to help mitigate that. So those would be...
That's amazing.
Yeah, I would say like those are kind of just big ones: the Cancer Heart Association and mental health, the crisis center hotline. But if it's something for Parkinson's, if it's something for MS, if it's something for ALS, or any other disease, pretty much every diagnosis has a page like that often has caregiver support options and/or phone numbers you're able to call and ask more questions for people who are more knowledgeable about that topic.
Thank you so much for that, Dr. Cat. I think that's really awesome. I think if people are ready, willing, and able to get some support in these caregiving situations, you might as well take advantage of them. Because you had already mentioned things like being able to take care of your health, doing things like eating more nutritious diet, and being able to go for walks or getting some movement. And you're saying that all these things can help you take care of yourself. And that's all based on what to do once you're in that situation where you are caregiving. Now, if you don't mind, I'm going to switch up the topic a little bit. When it comes to avoiding getting to that place where you need to be taken care of, basically when it comes to maintaining your independence, what tools are really important to have in your toolbox when you're looking to avoid this situation?
Definitely. It's trying to keep it simple. It's, movement is better than no movement. You don't have to do a 2-hour intense workout to do something effective for your body. So that's where, if it's 5 minutes, 10 minutes, if it's walking, if it's biking, if it's dancing, if it's, something you enjoy, just keep it simple. Find some movement that you can do. I mean, my living room that I'm sitting on my yoga mat. This is my gym. And one of my PT school friends, he was visiting me over the weekend, and we literally did an AMRAP in here. And I don't know how big this room is. If it's...
Yeah. For those of you guys watching who doesn't know what AMRAP is, that means as many repetitions as possible of certain movements.
Yeah. So we did bicep curls, incline lunges, squats, sit-ups, kettlebell swings, and deadlifts. And
nice.
All with just my kettlebell and dumbbells right here. And we moved around each other in a circle as we went to each station, and
That's
we
fun.
just got it done. We did it 20 minutes. We got the sweat in, and we started our day off that way. And so that's where, just keep it simple. If easier doing it with a buddy, like I walk with my neighbors, that helps keep you accountable. Oh, you want to go for a walk? And then you have like that socializing, and that adds community and an outlet to talk to. And that, by having people to connect to. And the pandemic made that hard, with all of us being isolated from one another, and kind of added then to the mental health crisis that we are all facing as well, or knowing somebody in a more, who has been dealing with mental health issues from the pandemic or even before the pandemic or since. And just there's a lot of moving pieces in the world right now that are adding to stress and overwhelm with careers, with financial security, with access to food, just housing, a lot of pressure that can fall on people. And when you're in those very stressful situations, trying to find ways to mitigate it or give yourself that time. And that long term, those little habits, those small things you can do every day for yourself, whether mentally, physically, spiritually, that all adds up for your long term health and trying to maintain your independence. And I'd say be proactive. If you have the means and you have the ability to, work with a med, work with a personal trainer who's going to look out for you. If you have a shoulder issue, instead of just ignoring it until it gets worse, see if we can work on it first, and get you moving. So now it's not a massive issue. It's just the minor one that gets alleviated sooner and keeps you functioning. If you notice any weird symptoms, like red flags, for example, are screening tools that my dad ignored and didn't tell us about, and they were all indicative of cancer or some pathological disease, and that was bladder bowel dysfunction, vomiting, drastic changes in weight loss or appetite. So let's say if you drop 30 pounds in a week or two, like my dad did, but it was also from vomiting, not keeping food down, that's a problem.
Oh my God.
Severe night sweats, night pain, severe numbness and tingling in one or all extremities, and any, just AWOL symptoms, as I'll, put it. Just they don't make sense. They came kind of out of nowhere. They can't be replicated, or they're very visceral. So they're organ, like, again, the vomiting, bladder bowel dysfunction, like they become more severe. And those are symptoms you shouldn't ignore, and that you should go see a physician right away, get checked out, and make sure, that they get you the proper tests and screenings, like to make sure that it's not cancer, it's not something more serious. So always be on the lookout. Your body, what's normal and what's not normal. And if you don't know, which is okay too, that's when reach out to a provider you trust to help you find that answer out.
Yeah. So for those of you guys watching this, basically take care of your health physically, mentally, spiritually. If you have pain issues, go to somebody like Dr.Cat. She's somebody who really cares and somebody who actually takes the time to listen to you, not take 5 minutes like some other doctors will to just basically give you a prescription and then run you out. So I think everybody who's watching this, make sure that you're paying attention to your health, make sure that you're taking care of things and not avoiding problems that come in your way, but rather taking care of them, being proactive, right, Dr. Cat?
Yep, that's it.
Awesome. And so before we go here today, first of all, I want to make sure people can find you and reach out to you. And I want to also have people get to know you a little bit better. And I'm sort of curious. So is it okay with you if I ask you 3 quick questions?
Yes.
They're kind of unrelated.
That's fine.
They're very unrelated.
I'm game. Let me.
All right. So what is one quote that you live by?
Oh, I always, oh God, and now I'm gonna butcher it. I know this. It's like champions aren't made in the gyms. It's this like sweat, tears, and work that happens when nobody's watching. I'm off with the quote. I know it, but essentially the whole point. I think it's on my Facebook somewhere, which I'm like, I have to pull that up on, and get it. But basically that always motivated me of, working out outside of practice and, shooting hoops or doing wall ball for lacrosse or just getting movement in, or like obviously being business owners now, it's the hustle stats. It's we have to work when nobody's watching, and that always was my drive of like, I don't need the glory, I don't need the approval or the praise. I'm going to get the work done because that's what I want to do for me right now.
Goosebumps. All right. I like that one. How about this? What is one book that you would recommend everybody to read?
Well, given that we're on a caregiving topic, I
Here we
will
go.
say one of my patients gave me Final Gifts, which was a book written by two hospice nurses on the common themes they saw working with people in the final stages of their life. And that for me was so moving because I read it in my dad's final month, and it allowed me to pay attention to the small details or to know what's normal. If you have the privilege or desire and or you might not desire it, but if you're able to be with somebody as they pass or as they are transferring into whatever comes next, or transitioning rather, that book just helps me pay attention to the little things and be present with him and try to listen for the small subtle hints of what beautiful things might come next. So it was, and it also gave me the tools to not be as nervous when he had a spike of energy or in a way of like hope of like, no, he's not going to get better. Like it allowed me to know the common symptoms of near death. And what you might look at as confusion, but it happens whether people are on medication or not. So Final Gifts, I forget the author, but it's a beautiful read, and for anyone who might be caring for an aging parent or loved one, hopefully they won't have to be in a hospice or terminally ill situation, but if they are, it's beautiful, and hospice was wonderful, and that book just really helped guide me in those couple weeks.
Wow. Thank you for sharing that. Yeah, Final Gifts. Okay. Final question.
Yeah.
If you could have dinner with somebody dead or alive, who would it be?
Ooh, this is a hard one. I would say Kelly Starrett, because I took one of his courses. So I met him in person. He was just a fun, smart guy. He's a
a big
PT
guy,
guru.
isn't he?
He's like a PT guru who works with a lot of CrossFit athletes. He kind of paved the way for changing the PT model and was just very, very smart. So getting to talk to him more and learn from him, I would definitely enjoy.
That's awesome. That's awesome. Well, listen, Dr. Cat, thank you so much for coming over here. I want to make sure people can reach you. And so everybody take a look at this over here down below. Call or text 631-317-1222 to learn more about powerful PT services with Dr. Cat. You would be oh so lucky if you get a chance to work with her. She is amazing. And I really appreciate you coming on today and telling people about the lessons that you learned with caretaking and telling people about how to take care of themselves and giving them the resources that they need to be able to go through this tough situation and making sure that they know that what they're doing is their best and that they should have grace with themselves as they move forward and as they continue their journey towards taking care of their loved ones.
Yeah. Thank you so much, Ahmed, for having me. And again, you're great at this too. And you're a wonderful provider. So I'm happy to be able to get to know you more as well.
Thank you so much. Dr. Cat, enjoy the rest of your night. Everybody watching, this has been Ahmed from Fitness, where we want you to move and exercise pain-free. Take care.